So, very welcome from PISA and from me. My name is Matthias Schneider. I'm from Dusseldorf and I'm working for more than 30 years with lupus patients, and also with self-help groups. Therefore, the organizers choose my topic pro. Not professional, but patient-reported outcomes. So it may be relevant for you to understand what's the issue with that. So we have seen that especially in lupus, there's two different views on the disease. So one view is from the physician part. The physicians are looking on your disease activity, on your blood counts, on your joints, on your kidney function, something like that. And that gives them the expression or impression how active your disease is. And quite independent from that is your view as a patient on the disease, mostly defined by something that's called health-related quality of life. There's a lot of patient-reported outcomes on the way, and they are all validated and they are fine, but they are not reflecting in any case the physician perspective on the disease. So we know if you improve your clinical situation, then that doesn't mean that also your quality of life is improving. Therefore, it's very important to document how your quality of life is. We know that your quality of life is influenced by a lot of factors. First of all, clearly by pain. Also then, mostly by fatigue, that is more than 90% of you have fatigue, at least periods of fatigue. And then by other things like social contact, not performing the things that you want to perform, and so on. And this is not addressed mostly in the clinical situation. Physicians look on their part, and we learned also from some evaluation that you as a patient even don't mention anymore your fatigue, your pain, whatever, because you learn, oh, I will take care of it and the rest is probably irrelevant. What I'm doing here is for the students to clarify that this is really a very important aspect of your disease. And that's important to integrate the patient view with the physician view, look on both, and then define the therapy. It can be that the therapy for your fatigue is different than the other one, but in any case, we know if you are fatigued, you lost your job, you are going early to retire, even if the rest is fine. So we have to address it. Sometimes we don't know where it's really coming from, the fatigue. Mostly we expect it's from disease activity, but in other cases it's just coming probably from a malfunction of the thyroid gland, or it's coming from anemia, or it's coming even from depression. There's a lot of other diseases that have fatigue as a problem, for example cancer, or also rheumatoid arthritis. And we now think that there's some changing in the brain, some inflammation, that is leading to this fatigue, for example. So therefore, it's important that the physician also focus on your view. And then finally, to bring these things together is closing this gap on the different aspects of view. It would be important, for example, running trials that primarily focus on your health-related quality of life. And also that you have instruments with which you can express what you feel, what you think, what's your major problem with the disease. And there's instruments out like the Lupus activity tracker that can help you to speak with your doctor about that. That takes time. There's also the problem why physicians probably don't focus so much on it. So that's the point. For me, it's important to integrate it, to come to one integrate, unified view on that, and then handle this. For you as a patient, it's important, don't forget to speak about your impression of the disease, what is your handicap with it, that it's addressed by the therapy.